Hello, and welcome to the TPP Learning Academy. Today we're going to look at how to use the repeat dispensing functionality within System 1. This video will cover a brief introduction to repeat dispensing, setting up repeat templates for repeat dispensing, how to repeat dispense, and cancelling repeat dispensed items. So repeat dispensing allows a patient to obtain repeated supplies of their medication or appliances without the need for a prescriber to sign repeat prescriptions each time. Any patient who is suitable for repeat medication could be suitable for repeat dispensing. For example, patients on stable therapy, patients with long-term conditions, and patients that can appropriately self-manage seasonal conditions. If we want to identify which patients might be suitable for repeat dispensing, we can use the clinical reporting functionality to help us. For example, I have a report here that has been configured to find all patients who have had diabetic medication on repeat for at least 6 months. If repeat dispensed items are printed, multiple prescriptions will be printed for each issue, along with a single prescription which is signed by the authorizer. The prescriptions are then given to the patient, who will be able to take them to the pharmacy when required. If repeat dispensed items are signed and sent electronically, multiple prescriptions will be sent to the spine and a token will be generated for the patient. The patient can then collect their items from the pharmacy when required. The process for setting up and issuing repeat dispensed medication and appliances is the same for printed and electronic prescriptions. So we have a patient here who has some existing repeat templates, and there are 3 we want to set up for repeat dispensing. So to set up a repeat template for repeat dispensing, we need to consider the duration for each issue and the repeat template limitation. So we're going to start off by amending one of the repeats here. The configuration would be the same if we're adding a new repeat on as well. So starting with the duration, this will be how long each issue lasts. For this example, we want to ensure that each issue covers a duration of 28 days. To ensure that this is accurate, we need to account for the dose, the quantity, and the issue duration. If the issue duration calculator is enabled, changing the quantity will update the issue duration, and changing the issue duration will update the quantity, providing the dose is correctly specified. So now our repeat template is set up with an issue duration of 28 days. The next thing we need to look at is the repeat template limitation. When an item is repeat dispensed, it will issue up to the maximum issue count. If no maximum issue count is specified, we will be asked if we wish to specify the number of issues. So for this example, we're going to set the repeat template to a maximum of 6 issues. Our repeat template is now set up. When it is repeat dispensed, it will automatically issue the full 6 issues. Now, although it is possible to have repeat templates set up with different durations, review dates, and issue counts, it is a good idea to consider if it is appropriate for multiple repeat templates to have the same configuration to ensure that they're synchronized. So to repeat dispense, from the repeat template screen, we simply highlight the required items and then click the repeat dispense button here. This has now generated 6 issues for all items. If we look at the medication node, we can see all the issued items along with their individual start dates based on our issue durations. If we've set the repeat templates up with review dates rather than maximum issues, after we've selected the option to repeat dispense, we will be asked if we want to specify the number of issues. We can then manually add the required number, up to 12 issues, providing it does not take the issues past the specified review date. We can also see that repeat dispensing an item adds a flag to the repeat template itself, so we can see which ones have been repeat dispensed. Once the items have been issued, they can be printed or sent electronically in the usual way based on your local configuration. However, because we've repeat dispensed the items, the prescriber will only need to sign once for all the issues. Once the prescriptions have been sent to the pharmacy, the patient will be able to collect the medication or appliances when required. If a printed repeat dispensed prescription needs to be cancelled, this can be done by simply marking the required issues in error. However, the patient would also have to be contacted to return the outstanding prescriptions so they can be destroyed. The advantage with sending repeat dispensed items electronically is that the patient is not in possession of the prescriptions, so any outstanding items will just be cancelled from the spine. To cancel a repeat dispensed item that has been sent electronically, the repeat template itself will need to be stopped. To do this from the medication node, select the item, then click the stop option. We will then be advised that the item was repeat dispensed and we will need to cancel the repeat template. Select yes to confirm this and then provide a reason. To do this from the Repeat Templates node, select the item, then click the Stop option and provide a reason. We will then be informed that the repeat template has outstanding future issues and which of these issues will be cancelled via ETP. Please be aware that the spine does not send System 1 a message stating how many repeat dispensed items have been dispensed by the pharmacist. Therefore, discrepancies are possible if the pharmacist has dispensed any items in advance, for example because of the patient going on holiday. If in any doubt, the pharmacist should be contacted directly. If an item that was sent electronically has been cancelled, this will generate an electronic prescription cancellation task, informing us as to whether the cancellation request was successful or rejected by the spine. And please follow your local process in order to deal with these tasks. Thank you for listening. Please have a look at some of our other videos to learn more about System 1.